Well, hi, everyone, and welcome. I am Michael Morella, a managing editor at U.S. News and World Report. Today's webinar examines the pharmacy's evolving role as community health hub. First, we're going to hear about the latest edition of Best OTC Medicine and Health Products. U.S. News, in collaboration with the Harris Poll, recently surveyed hundreds of pharmacists about which over-the-counter medications and health products they are most likely to recommend, with the goal, of course, of helping our audience make more informed health decisions. After we discuss that project, a panel of leaders will dive deeper into the evolving role of pharmacists and pharmacies in today's healthcare ecosystem. Today's webinar was developed with support from CVS Health. As always, you can find more information about our speakers and past and future programs at usnews.com/events. Today's webinar is also being recorded, and it will be available to watch on demand on our site. So now I'd like to kick things off with our first segment. Here to discuss our best OTC medicine and health products are Sumita Singh, Senior Vice President and General Manager for Health at U.S. News, and Rob Yehelik, Managing Director at the Harris Poll. Over to you, Sumita and Rob.
Thank you, Michael. It's a delight to be here and to share what we're doing at U.S. News in partnership with the Harris Poll in this space. I will quickly, we have a couple slides for the audience that I would like to take everybody through. So this year, recently, in the month of May, U.S. News launched our debut Best OTC Medicines and Health Products rating and ranking. And the methodology partners for us was the Harris Poll, and Rob worked with us very closely, and he'll share the methodology and some of the insights. The question typically that we hear that I want to ensure is clear to our audience is, what is our mission and why did we pursue this category? And clearly at the highest level for us at U.S. News, our goal is simply to educate consumers and help them to make informed decisions based on data. And of course, in healthcare, expert recommendations really matter. So in this case, we surveyed hundreds of pharmacists to help us to inform this rating and ranking. So the value proposition is providing expert recommendations to consumers so they can make the best decisions when they are choosing over-the-counter, which is what OTC stands for, medicines and health products. The question that comes up is, well, why OTC? As you know, we evaluate hospitals, pediatric adult hospitals, and a variety of healthcare sites. Over-the-counter is a fast-growing category for consumers. Demand is increasing, and there are certain demographic trends that are driving. There's a real interest in self-care. Of course, technology is enabling that. Lots of applications, our website and such. The aging population, where Medicare and Medicaid supported consumers are looking for a low-cost, highly efficacious options, high-quality options. We know that pharmaceutical companies are also looking at ways that they can take branded prescription products towards OTC. So there are two trends, certainly in healthcare and aging population, that are relevant. And also the pandemic. As you may remember, many of us during the pandemic were looking at over-the-counter meds so that we were choosing products from a preventative standpoint. So there's a real prophylactic use case of OTC. And those trends are important for us at U.S. News to ensure that we as a brand are providing consumers with decision support in this category. The other reason which begs this and supports these trends is consumers on average, and this data is dated, it's from 2015, I'm sure this is a lot higher now, are making about 26 to 30 trips a year to the local pharmacy, online and in person, to buy OTC over-the-counter products. In comparison, they only visit their doctor about 3 times a year. So there's a lot of interaction and opportunity for learning, if you like, for these consumers, provided of course, by U.S. News, and also the role the pharmacists are playing in ensuring that those 26 to 30 decisions that consumers are making are informed with a meaningful, trustworthy, and a fact base that is impactful in better outcomes for consumers. And lastly, why pharmacists? As I mentioned, with the increasing trends towards over-the-counter, as well as a frequency of interaction that consumers have with their physical local pharmacy or online, is to build recommendations and insights that pharmacists are supporting. So, we at U.S. News, particularly in the healthcare space, look at areas where consumers are making meaningful healthcare decisions. And our role is to provide consumers with insights that help them to make high quality decisions in this regard. And there are brands and companies that are in this space, and our role is to ensure that consumers are making informed decisions as it relates to over-the-counter medicines and health products. So what's our history? Why are we here? Why am I so excited about our new partnership and our new launch? I want to highlight that prior to this year, we did produce an over-the-counter ranking with another third party. This year, we decided that having real pharmacist feedback and informing the survey and data collection in a way that not only allowed pharmacists to give us recommendations for the top brands that they would recommend, but also generating insights that are useful for consumers. We really want to go deep and as broad as we possibly can. And that led us to our partnership with the Harris Poll, which we are very excited about. And Rob will share some of the insights that we've generated through our survey. In the survey that we executed with the Harris Poll this year, we evaluated over 700 brands in 99 categories. So it was very exhaustive. And we asked pharmacists to rate and rank the brands that they recommended. And again, methodology questions, Rob will answer momentarily. We also changed and evaluated our website experience to ensure that consumers were not just getting a ranked product, but also decision support associated with that. And that's where the editorial engine and insights that US News has, we bring to bear to the consumer. And of course, as I mentioned earlier, the insights related to the pharmacists are also part of this strategy. So it's a much more comprehensive value proposition. And it's just the first year in this partnership. And I imagine as we learn and enhance the value proposition, it gets deeper and richer as years go by. I just wanted to share a quick screenshot of what this looks like at US News. You can certainly go to US News Health and look at our OTC rankings. And as you see here, we provide insights as to why you should trust, methodology details. And in addition to that, to the left, you'll see, we are also offering consumers the ability to look at common side effects, what are the active ingredients in the products, and other articles and other content that they can read and make decisions on. And again, as I said, if you're making that many visits to buy OTC products, the more insights and information we can provide, the better off the consumer is in making their healthcare decisions. Some of the categories that we evaluated, you can see 3, as I mentioned, there are about 90 plus. Cough, cold, and allergy is the leading in terms of, we look at search volume. Consumers search for this data online. And again, that's where US News comes in providing high quality decision support for these kinds of decisions. And I know we have a panelist in this session who comes from CVS, and we have a partnership with CVS whereby when consumers are looking for a particular product and they are ready to make a decision, they can certainly go and acquire that product, if you like, at cvs.com. Before I close and hand over to Rob to take you through methodology and insights, really the heart of what we are trying to do here at US News is ensure that for those decisions that consumers are making and for over-the-counter drugs and medicines, their relationship with the pharmacist is really important. And our ability to get high quality recommendations from pharmacists to inform consumers to make the best decisions they possibly can is really the mission that we are trying to achieve through this ranking. With that, I will hand it over to Rob from the Harris Poll to take you through the methodology. Rob, I will drive the slides.
Thank you so much, Smita. And just, a privilege to be working with US News on this project. Just as I think was alluded to, this really is a kind of a formative piece of research, and we're very proud of it because of our deep expertise in the healthcare space. So also pharmacists are just such an important and ever increasing key kind of influencer and decision maker within the healthcare system. So a really kind of a key piece of seminal work. So within the research that we did in partnership with US News, our focus was on customer-facing pharmacists. So what we went after were over 350 pharmacists. The sample was weighted to be representative of the U.S. Again, looking at customer-facing pharmacists based on race, region, full and part-time, as well as gender. So a really good look in terms of what's happening in terms of the pharmacy and pharmacist space across the country. The research was fielded in March, so a pretty recent set of insights. And as Samita alluded to, it was a really robust process of being able to not just kind of get an overall evaluation of individual brands, but really getting pharmacists to dig deep and make decisions between them. I will say, as a personal anecdote, there's a number of categories where I'm actually using different brands, or our family is, because of some of the insights. So there were a number that we tried and really liked. Especially in some of the as you alluded to, allergy and cold. So I found it personally useful. So it was a really fun project to work on. In addition to the core ranking, as Samita also mentioned, we also wanted to set a little bit of a broader context, which is obviously one of our big priorities at the Harris poll. So if you go to the next slide, please. Perfect. So we'll give you a couple quick snapshots, and hopefully these will be a nice segue into the panel discussion. But big picture, when you think of pharmacists and you're looking at more of the intersection with consumers and OTC, there's a number of kind of big picture takeaways, and I'll go deeper on two of them. First and foremost, as many know, pharmacists, they really feel under pressure from a time perspective. That really is one of the number one things that's very top of mind for virtually all pharmacists. At the same time, they are very thoughtful, and they're thinking about what does the interaction look like with consumers and what are some of their concerns. So one of the things that virtually all pharmacists also agreed with is that patients don't fully understand what pharmacists can be consulted on, right? So this is absolutely a very important takeaway. The level of understanding and knowledge of pharmacists is very deep, and obviously many consumers aren't taking it as much advantage as they could be. Also, there's consumers, pharmacists believe that consumers have a lot of myths about OTC medications. Pharmacists are in a lot of conversations, and they're quite consistently running into some really problematic preconceived notions. We'll talk a little bit more about some depth on what some of the ones that really stood out to pharmacists in one of the following slides. In addition, patients don't consult. Pharmacists believe that patients don't consult with pharmacists as much as they should, right? So it's both a lack of understanding and a lack of engagement, but it just really reinforces when you're thinking about the trends that Samita set up so nicely at the beginning, as we're moving from defensive health to more proactive health, as you're looking at more of an aging population, pharmacists will only become a more important cog in the whole healthcare system. As was shown during COVID, right? There's a lot of roles that pharmacists and pharmacies took over that previously were untouched, if you're thinking of COVID vaccines and others, right? Where a lot of things just couldn't happen without pharmacies and pharmacists. Let's go to the next slide, please. So as we go a little bit deeper, and both this slide and the next one, there was some really nice editorial built out by US News. So I'd encourage you to take a look at that coverage as well. But the first snapshot is when you're thinking of pharmacists and their lens in terms of the questions that they believe consumers should be asking more often, right? There's a number of questions that really stand out. What we're showing you on this slide are really the top questions. We looked at a total of about 20. These are really the top ones where over 50% of pharmacists believe that consumers should be asking them more often. No surprise, the number one was around what side effects can I expect from this medication, right? But when you look at the overall kind of set, it really goes across side effects, usage, as well as affordability. The affordability one is really interesting as you're looking at that decision-making process. It's not just kind of quality, efficacy, and side effects. Affordability is also one of the big questions that comes forward. So side effects, affordability, what OTC medications would they recommend? Pretty much a direct pull through to the ranking and the research that you're seeing here. Pharmacists certainly think that consumers should actually be asking more around that, as well as things, top line items like how long can I be using this med? What are some impacts if I'm pregnant or breastfeeding? And then also even looking at follow-up and intersection with your doctor. So a lot of key questions that pharmacists would expect and would want for consumers to be asking more. Let's go to the next slide. Thanks, Smita. And this will be kind of the final insights pull through. We're here some of the bigger myths that pharmacists feel that consumers have about OTC medications. And some of these certainly are really kind of pressing or cautionary tales, if you will. Again, as with the last set of insights, there was a nice piece of editorial from US News. So I'd encourage you to dig deeper and take a read. But some of the most concerning myths pharmacists have are really around medical interactions and dosage, right? So there's a very strong feeling with virtually all pharmacists around some of these myths being quite prevalent. The first kind of myth that they're very concerned about is not having to worry about OTC meds interacting with other medications, right? Interactions can actually have a large startling impact. So that was the number one concern. Number two was it being okay to double dose OTC meds when you forget a dose. Highly concerning with virtually all pharmacists. And then the last two to kind of round out that top ubiquitous, virtually all pharmacists said, is it's okay for kids to take OTC meds that with reduced dosage. Obviously, that's a very big concern. And the last one is it being okay to increase the dosage of OTC pain meds if you have a lot of pain. So hopefully a good kind of rounding out in terms of the both looking at the ranking and then what's in pharmacists' minds as they think of consumers and their role in the healthcare system.
Thanks, Rob. With that, we just wanted to round out what we're doing at US News in terms of over-the-counter decision support for consumers. These insights inform our editorial strategy and the content and tools we provide to consumers. And of course, it is more important than ever as more and more consumers go to their local pharmacy online or in person, that recommendations that are given by pharmacists become a big part of the decision toolkit. With that, I'll hand it back to you, Michael. This was a wonderful opportunity for us to present our project.
Wonderful indeed. Thank you so much, Sumita and Rob. And I really appreciate that you helped set the scene and tee up some of the topics that we're going to explore in just a few moments with our panel. So with that, and before I turn it over to that panel, I do want to just reiterate that if you want to read more of and about our rankings, along with a wealth of related content, you can visit health.usnews.com/OTC. So now I'd like to introduce our panel. With us today are Dr. Todd Karpinski, Chief Pharmacy Officer and System Vice President with West Virginia University Health System, Dr. Sandra Leal, Vice President of Pharmacy Practice Innovation and Advocacy for CVS Health, and the immediate past president of the American Pharmacists Association, and Dr. Michael Murphy, Advisor for State Government Affairs at the American Pharmacists Association, and an Assistant Professor of Clinical Pharmacy at Ohio State University College of Pharmacy. Welcome to you all, and thanks for making the time to be with us today. Now I'll turn it over to Shanley Chen, Senior Editor of Health at US News, to lead the discussion. Shanley?
Thank you, Michael. The COVID-19 pandemic has impacted virtually every element of healthcare, forcing the industry to change in some way, shape, or form. And while many people think of the pandemic as affecting hospitals and its staff, it's forcing pharmacists to take on a very different role as well. As Sumita and Rob mentioned, the US News OTC survey conducted by the Harris Poll highlighted several key trends and misconceptions, particularly about what services pharmacists can provide. Contrary to popular belief, pharmacists do more than just refill prescriptions. In fact, the survey showed that 91% of pharmacists agree that people don't fully understand what pharmacists can be consulted on regarding their health and health products. And in recent years, especially post-pandemic, the role of the pharmacist has changed, establishing themselves as alternatives to traditional providers and serving as community hubs for primary care and vaccinations. And a bipartisan group of legislators want to expand their role in healthcare. They recently introduced H.R. 1770, the Equitable Community Access to Pharmacist Services Act, which would enable pharmacists to expand their testing, vaccination, and treatment services beyond COVID-19. And I'm excited to pick the brains of our panelists here today. Starting with Sandra, based on your experience and expertise as a Vice President of Pharmacy Practice Innovation and Advocacy at CVS Health, can you explain how the role of the pharmacist is evolving and what ramifications HR 1770 would have if the bill goes through?
Thank you, Shanley, for the introduction and a little bit of background there on what the pharmacists have been doing. You know, pharmacists have been doing so much work, and to your point, so much more than dispensing We at CVS Health have been working on a lot of key efforts, especially around the pandemic. Definitely, the pandemic exposed individuals to what the pharmacists could do. Vaccinations, that was happening before the pandemic, but really expanded during the pandemic. A lot of the testing, ability to be able to walk into the pharmacy, be able to have a test, and then also have treatment. And then looking at treatment potential, pharmacists had the ability to prescribe Paxlovid for COVID as part of federal government authorization. So these were all incredible opportunities to really showcase what pharmacists could do. But beyond that, pharmacists were also doing other things with expanded scope. As an example, at CVS, we have 10 states where pharmacists can prescribe hormonal contraceptives. Another area that's really picking up steam, just because we know that this is such a high priority for access. And there's other scope opportunities where pharmacists are really leaning into to provide care, to address care gaps for patients, and to really be a care provider and make sure that people have the care they need, sort of as a in between when they're seeing their providers.
Absolutely. Now I'm curious for Todd and Michael, how do you see it changing from an academic standpoint?
Yeah, I think during the pandemic, we really got to see what health system pharmacists can do for the communities. I know here in West Virginia, we helped to lead the vaccination of all of our nursing homes in our state. We stood up 4 large vaccination centers across the state to really get the vaccines out. And we're fortunate to really lead the way in the beginning with vaccination rates in West Virginia that kind of tailed off at the end. But in addition to that, I think our ability now to provide virtual care, only about 8% of our visits were virtual prior to COVID. That jumped to about 40%. It's come down to about the mid-20s now, but we're really utilizing all of our practitioners, including our pharmacists, to provide virtual healthcare. And I'll mention this a little bit later, but our state, something that's very unique is our geography and ability to have transportation to sites. And so we've been able to use virtual healthcare to kind of combat that barrier that we have that is a bit unique to our state.
Absolutely. Thank you for that. And Michael, did you have anything to add to that question?
Yeah, I think Sandra and Todd's comments really hit the nail on the head here. I mean, pharmacists, for the past 20 years, every pharmacist that graduates from pharmacy school receives a doctor of pharmacy. And we've really seen in a better alignment of the pharmacist's role with their extensive education and training over the past several years. This really, the COVID-19 pandemic was really a catalyst and helped push forward some policies that expanded access to things like vaccinations and pharmacists' ability to test and treat using COVID-19 oral antivirals. And I think that we really saw the impact there. I mean, pharmacists provided over 50% of overall COVID-19 vaccines for the country, and that resulted in millions of less hospitalizations and over 1 million prevented deaths. So I think that we're really going to see pharmacists continue to be able to provide expanded services. But it's important to note that this is a part of pharmacists practicing as a piece of an interprofessional and collaborative healthcare team, working with our physician and nurse practitioner colleagues to really help patients reach their therapeutic goals.
Absolutely. And as all of you had mentioned, there's really a huge benefit to people, patients, and consumers by expanding that scope of practice. And I think I'd like to talk about the healthcare gaps that it addresses as well. So many Americans, especially those living in rural areas, still struggle to access basic healthcare services due to provider shortages, proximity, as you had mentioned, and other obstacles that are inherent to living outside of the city. For example, across the state of Texas, where I am, more than 3 million individuals live in medical deserts where there's limited and oftentimes inadequate access to affordable quality care. Many people have to drive hours just to get to the nearest doctor. But this could very well be an opportunity for pharmacists to step in and bridge that gap. So I'd like to open this up to everybody. How exactly can you talk about how pharmacists are expanding their scope to fill those gaps to reach underserved populations in rural areas?
Yeah, I can start. So yeah, certainly something I mentioned here is a challenge. Transportation is probably the number 1 and number 2 healthcare concern for our community in West Virginia. we have started within our health system to do things that we just don't see in other states due to our topography. In our specialty pharmacy, for instance, we have over 12 delivery drivers out doing daily deliveries because we will go where the US Post Office, UPS, and FedEx will not go. And there's probably a couple of reasons for that, both culturally and from just the geography of it all. So, I think when we have these types of rural states, like, you mentioned Texas and us in West Virginia, we have to get very creative in getting care to our patients. We've expanded all sorts of care, including pharmacy care, to very small towns to where the pharmacy may be the only healthcare provider. And I think what's becoming good, and I like to see Sandra here, and we have our retail and our health system focuses on pharmacy, but we're really wanting to partner with independent pharmacies in these small communities to see how can we partner, how can we share information, because it's all for the common good and healthcare of our patients. So how do we work together with our retail and independent pharmacies? So that's been an exciting thing in our state since COVID.
I have to completely agree with Todd. 90% of the U.S. population lives within 5 miles of a community pharmacy. So retail pharmacies such as CVS, as well as independent community pharmacies, can really step up to provide increased access to vital healthcare services. And we've seen many states looking to pharmacists over the past several years to provide expanded access to things like hormonal contraceptives that I know Sandra mentioned, and HIV pre-exposure and post-exposure prophylaxis medications, as well as other test and treat services for things like flu and COVID-19 and strep throat. And what's really beneficial about all of these different medications that the pharmacist can accessibly provide to patients is that it can help to prevent more expensive and impactful healthcare services later down the line. So if the pharmacist can be leveraged in these models, especially in rural and underserved communities, to help to prevent things like hospitalizations or emergency department visits, this not only benefits the patient, but it benefits the entire system overall.
I want to reiterate, Mike, your point on the proximity, right? 90% of Americans live within 5 miles of a pharmacy, and CVS, 85% of Americans live within 10 miles of a CVS pharmacy. That's incredible. Todd, you also mentioned telehealth and what we're trying to do with that to make sure people have access through telehealth visits, through telephonic encounters. One of the things that we did during the pandemic is that we implemented Epic electronic health record within all the pharmacies so that we could stay connected with the care team. As Michael mentioned, one of our goals is to collaborate with other providers, share information, make sure we have the information for that individual that we need when we're trying to make some of those clinical recommendations like labs, a full medication profile and history. So all of that intraconnectivity is very, very important, very key for us to ensure that people trust, what we're having, what information we have, and then sharing it back with a healthcare team. So very, very key things that have continued to evolve during the pandemic and has really pushed us forward in those models.
Absolutely. And I'm excited to talk about the collaborative efforts that are going on within your organizations and in the greater field in general. But before we talk about that, I definitely want to probe a little bit more on that topic of health equity, because you've all mentioned that pharmacists are indeed uniquely positioned to bridge that healthcare gap, especially with 90% of people living within a pharmacy. But it's a rather large gap that's widened by a lack of access, reliable transportation technology, and affordability. So can you talk about other ways that your organizations are specifically addressing those health equity issues and those social determinants of health? You mentioned virtual health as being one of them to help bridge the digital divide. What else are you doing?
So I can jump in with some of the services. As we mentioned before, we're really looking at what expanded scope opportunities we can help patients with. And some of the statistics I've read about trying to get an appointment with your provider, it can take up to 26 days and some specialties even longer. So what we're trying to do is really make sure we're an access point. We can advocate for patients. It was mentioned earlier that patients go to the pharmacy 26 plus times during a year versus the amount of times they're able to get in to see their provider. So how can we work with these individuals to identify areas of opportunity, make sure we're addressing some of the areas that they need access to? And we already mentioned hormonal contraceptive, but other areas like smoking cessation, really looking at other opportunities where we can address diabetes, for example, things that we know people are impacted with and that they can speak to a pharmacist to get them either care or advocate to get them to care, to the appropriate care at the right time. Those are all the areas we're focusing on. But to the points that were already mentioned around transportation and looking at ways to optimize care, those are areas that we're always looking at. What geographies do people need care? How can we solve solutions locally? What kinds of services do we have to develop in those areas? So I think data is really important to identify what those gaps are and then designing programs to be able to impact the community. And those are the types of things that we work on and collaborate with the community also.
One quick thing to add, I think that you hit on an important point, which is affordability. And that is one of the big things that we're focused on here at APHA, because historically, these services that pharmacists can provide that are within their education and training are not covered by health insurance, both public health insurance like Medicare and Medicaid, but also commercial health insurance. So one of the big things that we work on is ensuring that there is a pathway for patients to receive access to these services through coverage by their health insurance companies. And taking things back to HR 1770, the Equitable Community Access to Pharmacist Services Act, that's exactly what the legislation does. It doesn't impact pharmacists' scope of practice, but creates a pathway for pharmacist services to be covered under Medicare Part B, to ensure that those patients that are covered under Medicare can receive access to these vital healthcare services, especially in our rural and underserved communities. So that affordability piece is just so key for patients to be able to access these services from their pharmacist.
Absolutely. And based on everything you are all saying about the expansion of scope, everything from providing patient advocacy, seeking treatment for smoking cessation and things like diabetes, we're painting this picture of a very convenient landscape for consumers. When people walk into a pharmacy, they now have that ability to get vaccines, tests, and medications prescribed by the pharmacist. But I'm curious, based on everything that you're seeing and you're experiencing, are Americans generally receptive to pharmacists expanding their scope and serving their broader healthcare needs, or do they have reservations?
I think it probably depends on which Americans you're asking. I think there's certainly been a lot of pushback from other medical societies and pharmacists expanding their scope into this space, and it really is about where does the money go. I mean, at the end of the day, I think the overall general public is comfortable dealing with their pharmacists. We have for many years been in the top most trusted healthcare professionals. We have the highest level of accessibility. I think during COVID, the use of the pharmacy, it probably changed a lot of people's view of what pharmacists can do at Walgreens and CVS and other independent pharmacies. So I think pharmacists and our profession gained a lot of trust during COVID, that we're at a great time right now to capitalize on that and hopefully push some of this legislation through that we've been waiting years for. We were very fortunate during COVID in West Virginia to pass legislation around payment for pharmacist services. So anything in our scope, we are legally bound to be paid what we would pay a nurse practitioner. And insurance companies are bound to contract with us. So that was a great piece forward. And I know many other states passed similar legislation during that time.
We published a report. It's our first ever, it's called RX report. And we really looked and actually surveyed people on the trust issue. And what we saw is continuing trust in the pharmacist. 74% of the people that we surveyed said that they trust the pharmacist or their pharmacy team on services. And as we survey people, we're starting to see trends. This is not the only survey, but there's others that are showing this same experience. And to the point that Todd made, I think it's because they experience services like vaccinations, testing, treatment at the pharmacy, and they're seeing additional services that are coming to light, especially as people are experiencing, affordability issues, access issues, when they can go to the pharmacist, somebody that they go to frequently and ask questions and have information. That's going to continue to build that trust. So really, we're hoping that, some of this HR 1770 bill will help continue to bolster what we already started. Because I do see such a need in these areas for people to have the care that they want to achieve.
I see you nodding your head over there. Was there anything else you wanted to add?
I have to come back to Todd's comment about the trust factor. I mean, patients have longitudinal relationships with their pharmacist as they do their other healthcare professionals. And as we see the evolution of the role and ability for pharmacists to provide these services, we're going to continue to see Americans look to their local community pharmacists to provide increased access. And I think, it comes, that patient demand is a piece of it, but we're also seeing a lot of public policymakers, both at the state and federal level, looking more to pharmacists and helping to increase access to these services and really incentivize patients receiving them at such a convenient location, which is their community pharmacy.
And of course, these are very exciting changes, or rather exciting legislation for this, but unfortunately, it sounds as though not everybody is happy with that expanding scope of practice, namely the American Medical Association, which issued a public letter to House representatives in April opposing HR 1770. In the letter, they stated, pharmacists do not have the education and training necessary to assume the role of a physician, and this fact in isolation raises serious concerns about the underlying merits of this legislation. Now, the three of you have been on the front lines of this debate, so I'm hoping you can help me unpack that for the audience. Can you tell us about the resistance pharmacists are getting from doctors and other healthcare stakeholders?
Where to start? I think change is hard. Todd already mentioned it. There is, some concern about that. And I think one of the statements there is that we don't have the training to be a physician. We're not physicians, we're pharmacists, and we have an expertise that's unique to pharmacy and to pharmacists. So that's one thing that we're really, trying to highlight. We want to collaborate. We want to make sure that the patient has the best experience possible. And we already know there's a provider shortage. So this is really important to state. There is a lot of need out there, a lot of people that don't have access. So us working together is a better way to be rather than be in a sort of competitive, type of position, because we're really not. I think at the end of the day, with the providers that I work with the providers we work with, they're very collaborative. They appreciate how we work together. And so, I think, what we're actually experiencing in the field is very different from some of this dialogue.
Yeah, I would tend to agree with that. I think in the health system settings, our physicians, whether they're rounding or when they're in clinics, certainly want the pharmacists there every step along the way to help manage the patient's, therapies. And, it's been a while since I've been to pharmacy school, but the number of drugs on the market are just so many now. We need to have medication experts working side by side with physicians, because there's just simply no way a physician could cover the breadth of medication knowledge that our pharmacists have. And I truly believe most physicians deep down agree with that there may be just a few vocal few, namely the AMA, out there, but it really is a financial thing. I don't think it has anything to do with patient care.
And exactly to Todd's point, there are over 80 organizations that are supporting this legislation as a part of the Future Pharmacy Care Coalition. And included in that coalition and in that support are other physician organizations and nursing organizations and so many patient advocacy organizations that are really focused on the needs of patients and what we can do to help to address these inequities across our communities across the country. So it's important to recognize that one organization does not necessarily represent the entirety of a profession, and that we are seeing a lot of diverse support for this important legislation that helps to leverage the role of the pharmacist.
Absolutely. And based on what I'm hearing is that I understand that you think that the pharmacist is not necessarily to replace the providers, but to help ensure that there is that continuity of care in between those sometimes long appointment windows with doctors. Now that brings me to my next question. We know that besides HR 1770, which is the most clear and present obstacle right now, what other challenges and barriers are preventing pharmacists from broadening the role?
I think that's a great question. And A lot of this is decided at the state level in pharmacists' state scope of practice. So as we've discussed, there are about 26 states that allow pharmacists in some capacity to increase access to hormonal contraceptives. There are around 15 states that allow pharmacists to provide HIV, PrEP, and PEP services. But we're going to continue to see this expansion at the state level as more states go through their legislative processes and recognize the role and value of the pharmacist. And in addition to that scope of practice piece at the state level, there's also the importance to recognize payment for services by state Medicaid programs and commercial health insurance programs. And we've got about 28 states that allow for at least the reimbursement of one service provided by a pharmacist under the state Medicaid's program. So we're seeing this really grow and expand, especially over the past 5 years. But I think that, there's still another 32 states and the District of Columbia that we need to really focus on expanding access to both these different services that pharmacists can provide under their scope of practice, but also coverage for Medicaid beneficiaries and patients that have commercial health insurance.
Yeah, I would agree with Michael. That's one of the biggest barriers is just the variation between states and the practice acts that we see. And, that would be a great thing for our profession to kind of come together to have a national practice act and national laws that we're all being governed by that we may see with other healthcare professions. But I do see that improving. I do see a lot more collaboration between states around, oh, we heard Louisiana passed this law. Let me reach out to Louisiana. How did you guys navigate that? I also see a lot more collaboration between folks at APHA, ASHP, other pharmacy professional organizations. So I think, again, with COVID, we have so much momentum post-COVID with trust in the public, all of our collaborations between retail, health system, professional organizations. So it's really our time to push forward hard right now while we do have that momentum.
Yeah, and I would just wanted to add a plug for more consistency. We have over 9,000 locations for CVS, and we're in every state. So it's really, it's great that states are passing incremental progress state by state. It's hard to implement nationally when we're having different variances state by state. So anything that facilitates that consistency just makes it easier to operationalize. Not to say we're not, doing that work state by state, but when the federal government, for example, authorized immunizations and created more consistency to vaccinate kids down to the age of 30, that was incredible. That just really helped us be able to scale it, to stand it up versus trying to do it state by state. Same thing when for COVID treatment, when the federal government authorized prescribing by pharmacists, incredible. So anything that can help facilitate that really allows for us to be able to implement and then have that ability to provide care in a much, I want to say quicker. It wasn't easy, but it was easier to standardize it and to be able to stand up from that footprint that we currently have. So just incredible to be able to do that work.
Absolutely. And that kind of brings me to my next question. We talked a lot about the past and current challenges, specifically policy that your field faces, but I want to look at the role of the pharmacist from a different perspective, the future. Now, obviously, we don't live in a perfect world, but hypothetically speaking, in an ideal scenario, what would the pharmacists of today and tomorrow look like? What are the opportunities to expand the pharmacist's role even further?
I think the growing role of pharmacogenomics is huge. We're impacted by this daily with the various new oncology treatments and immunotherapies coming out. So I think that's going to be a key area for pharmacy. I think, too, having a pharmacist informaticist is going to be very critical for us going forward. We have tons and tons of data in our warehouse that is is very useful at identifying population health targets for the folks that we serve. We just don't necessarily have the people with that training and expertise, both from an informatics standpoint and a clinical standpoint, to identify those areas. And so I know that's one thing I've talked a lot about with our School of Pharmacy, incorporating more informatics into the curriculum and potentially creating certain pathways for students that may want to pursue that.
Yeah, and I'm going to chime in. I think you hit the nail on the head with two of the areas, Todd, that I wanted to mention. Definitely data and looking at the opportunities that brings to the table. You mentioned population health. I really think about that in the context of health equity and where we're seeing gaps where people really struggle for care and how we can leverage data to be able to look at these, these populations that experience disparities and then design programs that address that. The other area I'm just really excited about is public health. We saw the need for pharmacists to be able to step in and really impact the trajectory of COVID with our public health, infrastructure that we had as a pharmacy group, as a pharmacy system. So that's an area that I just see becoming more and more important, since there is a really challenging environment in public health right now. How do we do that? How do we prevent the next pandemic? How can we continue to be access points and be there and be ready? And it does come down to some of these efforts, like recognizing pharmacists, recognizing that HR 1770 to be prepared for next time. So those are just really, really key things. But data, population health, thinking about health equity and how we can really step into that.
Yeah, and I think that we've really seen pharmacists flourish or start to flourish in opportunities related to preventative healthcare services. I mean, immunizations, HIV, PrEP and PEP, test and treat. And I think that that's especially a big piece of the future of community pharmacy in helping patients to prevent further complications, to make sure that patients are happy and healthy, and preventing these more serious complications that can be much more expensive and need to be treated in emergency departments and in hospitals. So I think that's where the convenience of community pharmacies can be so beneficial, but it's going to take a lot of work both at the state and federal level in passing policies to help to incentivize and encourage patients to reach out and access these services from their local pharmacies.
Absolutely. And it sounds like everyone here on this panel is doing a lot in their field to push that needle and move that needle forward. But Todd, I want to bring this back to you because I am curious. You had mentioned that we have this increasing need for informatics to take on all the clinical data that's coming through in order to have that ripple effect and benefit all other areas of pharmacy care. So speaking of innovation and that future of healthcare, we're also seeing a new breadth of artificial intelligence technologies like ChatGPT emerge. And it's very much a double-edged sword. AI can be a powerful tool for good or bad, depending on who's wielding it. So in our previous conversation, I know that you had mentioned that AI takes the art out of medicine. Can you explain what you mean by that?
Yeah, I mean, obviously, advancement of technology and our ability to improve the care we provide patients is always a good thing. But as you mentioned, it can bring some untoward effects to it. And ChatGPT is only as good as the data that's being fed. And how do we know that the data that's being fed is the accurate data? And I also do think there's a very big human component to providing care. And I think that's the art. You can take all of the clinical data and put it into a machine and it can spit out a diagnosis, but we're not really talking with that patient. I had mentioned earlier that there was an article out today about how physicians are using ChatGPT to learn how to empathetically speak with patients. I find that very ironic that we're learning from AI how to be a human. But I think for the most part, it'll be a good advancement. I think it's just the way in which it's going to be used will be pretty critical. But I think from a population health standpoint, AI could be very powerful for us to get through the tons and tons of medical data that we all have.
Sandra, I know that one of the things that you had mentioned in this perfect world, one of your wishes for the pharmacists is to address that population health issue. So given ChatGPT and all these other AI technologies, what role do you see AI playing in helping pharmacists do their job more efficiently and effectively in order to address those issues?
I definitely see value in some of what's coming out. I mean, it's so new, right? And we're still learning what the capabilities are, but you can start seeing some applications, things like texting, reminding people on adherence. But again, I think that one of the key things to consider is the trust factor. Who is it coming from? What does it really mean? How does that even translate? In my career, I worked a lot with medically underserved populations that struggle with language disparities just because of the populations that I was working with. And it was always surprising to me what I would catch in an interaction with a patient that I really identified by really just sitting with them and understanding their culture, understanding their background, understanding their unique situation, like what their education level was, for example, what their affordability was, what economics they were having to deal with. So all of that, when you start looking at that, you can apply this technology or these guidelines to some degree, and then you have to actually talk to the person and understand what their experience is and how to apply that. So I think it's going to be another tool, just much like we have an electronic health record, much like we have devices, but it's not going to solve a lot of the individual problems people have. You still need that provider to build that relationship and to really understand that person's situation to end up having the outcomes that person needs to experience. So it's just another tool, but I do think there's going to be some incredible applications, and there is a lot of, like I mentioned earlier, a lot of data, a lot of things that we have to manage, and I think these technologies will help with that to some degree.
Absolutely. Michael, what are your thoughts?
Yeah, this is a fantastic question. I think, as Sandra and Todd said, with any advancement in technology, we're going to see a greater level of efficiency in healthcare delivery. And that can help to address inequities in patients being able to maybe not access healthcare, but because of this expansion and providers' ability to reach more patients, we can help to address some of those inequities. But I'm so glad that Sandra talked about culturally competent healthcare, and I think that's where healthcare providers are so beneficial. So I think, as was shared by Todd and Sandra, this is really going to be a tool in helping to increase the efficiency of healthcare delivery and can help to reach more patients. But the healthcare provider is a very much vital piece of care and will continue to be in the U.S. healthcare system.
Absolutely. As with all of medicine, we definitely still need to have that human element in our healthcare in order to ensure that patients have a great experience and have good patient outcomes. And that kind of leads me to my next question about innovation. I know you had all mentioned collaborative engagements and partnerships with other organizations, but I'd like to dive into that a little bit more. Obviously, innovation is really just born out of that partnership between organization in order to improve that patient experience. But Todd and Sandra, I know that both of you come at this from different angles. Todd from the health system perspective and Sandra from the retail pharmacy. First of all, can you address why is collaboration important in your field? And second, how can health systems better partner with brick and mortar pharmacies to improve care for patients?
Yeah, I'm glad you asked that question. I think that's been an evolution over time as well. I think it's really important for health systems to realize we're not going to have the level of access that our chain pharmacies provide our patients. What we do have is all of the medical information that is needed by all healthcare workers to provide the best level of care. And I think health systems have been very reluctant to give up that data, to give up that information. And I was really glad to hear Sandra say that CVS has now brought on Epic, because that allows now 60+% of our health systems to communicate healthcare information to the pharmacist at CVS who needs that information to really determine if that drug is right for that patient. So that's something that's been talked about. I mean, I was talking with CVS 10 years ago about that. And at the end of the day, there was just this trust factor that wasn't there. Where you have not-for-profit health system partnering with for-profit, CVS, Walgreens, whoever. But I think that's really changed. And I think it's a good change. It's a needed change for us to provide the best level of care that we can. And health systems have evolved. We're not just providing hospital-based care anymore. We have our specialty pharmacies and our retails, and that's great for us to capture that business. But for me, most of my patients live 3 hours away, where the only pharmacy in town is probably CVS, Walmart, or Walgreens. And so we need to have those partnerships and the ability to hand off care when needed.
Oh, absolutely. I'm so glad we're evolving in the right way. And, to your point, Todd, connecting finally leveraging some of the tools and the technology that we need to communicate. Just as a patient, the experiences of having transitions in care. We talked about that all the time. Passing one person off from one system to another. There's so much fragmentation in that and so many missed opportunities. What we really needed to design is a way for that person to have that continuity and not have that fragmentation, because we don't want to end up leading to more hospitalizations or side effects or duplication of therapy. And so it's really in the best interest of the patients that we're serving to collaborate, right? And we all have a vested interest in having people have better outcomes. We want them to have the right treatments, and this is why we're investing in these technologies, because we know that's what we need to do. It's just unfortunate that it's taken so long to get there, because to your point, we've been talking about this for years and years, but we're finally starting to see that work happening and really looking at ways to partner more. We're looking at that. We're looking at collaboration. We're again looking at the interoperability, the technology, how we message providers, how they can more seamlessly message us and get beyond faxes and get beyond calls even, so that we can connect more real time. And so those are the kinds of things that we're investing in to try to make sure the patient, at the end of the day, that they have the best experience possible.
Definitely. Michael, from your perspective and in your experience in your area, what are some other opportunities you see for collaboration?
Oh, yeah. So we at APHA represent the nation's 300,000 pharmacists, as well as pharmacy technicians and student pharmacists. So pharmacists that work in health systems as well as community pharmacies. So I think, as Sandra and Todd really spoke to, there's a greater need for coordination and collaboration from both an inpatient and outpatient setting to ensure that we are working to address challenges in how patients are accessing medications, especially after they leave the health system, and if patients are going into a hospital, there's a better understanding of the medications that they're taking, and that can help with more efficiently addressing issues that patients are dealing with in the health systems. So I think that overall, we are seeing a lot of expansion in these opportunities to collaborate and partner from both inpatient and outpatient pharmacists, as well as other healthcare professionals. And at the end of the day, that's going to end with better patient care, and that's what we're all striving for.
Absolutely. It definitely sounds like it's a very exciting time with all these collaborative efforts and initiatives that are going on at all the different organizations. So we've covered a lot in our time here today, but before we wrap up our session, we do have a few minutes left for some questions for the audience. And I understand that this one might be a question that kind of segues perfectly, because we were talking about collaboration already. You spoke about collaboration, but an audience member posed this question. I participate in a collaborative that brings pharmacy and community-based care coordination together to reach rural or older adults who struggle with multiple chronic conditions and numerous meds. This allows for the pharmacist to get eyes in the home and understand quality of life impact for the patient. The care coordinator also supports the patient with pharmacy recommendations and learning self-management skills. Have you seen other examples of pharmacists, interdisciplinary teams collaborating with community-based care coordinators or community health workers?
Yeah, one thing that we've started here, I also have the opportunity to oversee our home health and hospice service lines for the system. So we've really noticed that as we go in and provide home care to patients, that there is a need for them to connect with the pharmacists around their medications, especially, high risk, high dollar medications. So we're incorporating the nursing's home health with an assessment of medication adherence, and then connecting back with our pharmacy, whether it be the specialty pharmacy or one of our local retail pharmacies, or a pharmacist in a clinic, to provide whatever they deem that they may need, whether it be an adherence, whether it be an affordability thing. So as we're providing more care in the home setting, it's just another opportunity for us to ping our patients. Are you taking your meds? Can you afford your meds? Those types of situations. So that's very new for us, but I think it's pretty exciting.
No, I agree. We're looking at the same exact model with our recent acquisition of Signify. It's home health. It's looking at how to connect the pharmacist with that work, and then being able to have eyes inside the home and really be able to address issues that we're identifying. But I love this. This is exactly what I think collaboration should be. working with community health workers, making sure you have trust agents within the community that then connect people to care providers is just the right way to go.
And to wrap up here, really across the country, I think that we're seeing examples of pharmacies hiring community health workers, social workers, registered dietitians to really help to address whatever specific needs the patient has. And I think those collaborative efforts with different members of the healthcare team can really just be of benefit to the patient as they're coming in to access care at their community pharmacy.
Wonderful. And that's all the time we have for questions and for this panel. With that, I'd like to thank everyone on our panel today for taking the time to share their expertise and insights with us, as well as the audience for joining us today. To read more of our health coverage and to see our rankings of best OTC medicine and health products, visit usnews.com/health. And if you enjoyed today's webinar, you can sign up for future events, including our June 27th webinar on the changing face of cancer at usnews.com/events. Thank you, everyone.
Thank you.